Hi, I'm Sam Lowenberg, reporting from southern Mexico, where I was trying to understand why women giving birth are dying at nearly twice the rate of the national average. The high rates of maternal mortality are a sign that for many of the disenfranchised people here, the health system as a whole is broken or inaccessible. The women, and often teenage girls, who are affected by this problem of maternal mortality are mostly indigenous and/or poor, usually living in rural communities with little infrastructure or health services. Getting to a hospital can take hours, and when a woman starts hemorrhaging after giving birth, that delay can be fatal. And even when they get to a clinic, the waits are often long and they may have to buy their own medical supplies. Despite government efforts to reduce the maternal mortality rate, which has generally been successful in the country as a whole, in the poorest states where I was reporting, Oaxaca and Chiapas, the rates of death are still very high. This is especially troubling as these are usually preventable deaths. Many indigenous women are basically cut off from the state medical system. Poverty rates are high and education is low, so that means that many women don't speak Spanish and they can't communicate with doctors. The fact that the doctors are usually male and are pushing and probing them in gynecological exams is also a real problem for these traditional communities, where birth is often done with a midwife. The poor health conditions have been the object of big political protests from these indigenous groups and grassroots organizations, who say that local governments are spending money on sweetheart projects when it should be going to aid for the poor. Meanwhile, a lot of innovative work is being done by NGOs like the Casa de la Mujer in Oaxaca to help young indigenous women get an education and learn about reproductive health so they can help their own communities. But for many women and girls in Oaxaca and Chiapas, giving birth still means risking death.